Hello and welcome to the Future Virology 2023. In this presentation, I'm going to talk to you about the proactively preventing future viral and epidemics and pandemics using natural immunity. So when the infection is geographically demarcated, it's called epidemics. In one country, maybe the group of countries neighboring. Whereas a pandemic refers to when there's a worldwide spread of an infection, just like it happened in the SARS-CoV-2 3 years ago. And it could be due to bacterial or viral infection, and it could be the new or old virus becoming hyperactive again. The questions are, who are the vulnerable groups for these epidemics and pandemics? Which groups of population will be mostly affected? And what criteria make people or persons more vulnerable? All these three questions were failed to ask by the leading health authorities during the COVID pandemic. Thus led to significant chaos, hospitalization, and excess death. So we also know that for years now, viruses mutate naturally. Sometimes they become less active. Other times, with gain of function of viral mutations, as happens several times now on SARS-CoV-2, it can become more virulent or at least increase the infectivity or RO as they call, especially when it affected the binding domains. And many of the coronaviruses, there are so many, they are harboring by the animals. So spillover to humans can happen occasionally, not frequently. Similarly, it can have happened by releasing from high security viral laboratory, which has been suggested as a cause of the origin for SARS-CoV-2. Thirdly, they are spread. Outbreaks are depending on their RO values. So the frontline defense in humans are purely by our innate immunity. It's a crucial part of immune system, particularly very active among children and less active become older people. That's one of the reasons why the older people got mostly affected during the COVID pandemic. And the second line or established defense system for us is the adaptive immune system, that produces the viral detection system, memory cells, and indeed production of neutralizing antibodies. Nevertheless, the robust function of the immune system, irrespective of the age, is depending on the micronutrient adequacy. This has been neglected by immunologists and not even mentioned in any of the current neurological textbooks. So, in addition, the 75% of the innate immune activity is depending on the vitamin D availability in sufficient quantities in the circulation, D3 or 25-hydroxy-D. So innate immunity function can be robust when they're having the serum 25-hydroxy vitamin D level above 50 nanograms a ml. In some countries called 125 nanomoles per liter. It indeed stimulates all immune cells, such as intracellular signaling with autocrine and paracrine signaling, as well as the cell membrane-based like gap junction strengthening and the production of antimicrobial peptides. Whereas adaptive immune system is particularly involved in the cellular immunity and production of the neutralizing antibody and memory cells. So maintaining the immune systems required having the serum 25-hydroxy vitamin D above 50 nanograms per ml. I will show you a few slides, published data for you to convince that's the case right now. In addition to proper functioning of calcitriol intracellularly and the vitamin D receptor requiring the multiple cofactors. In the deficiency of any of these, like magnesium, for example, or omega-3 fatty acid, boron, or zinc, for example, can lead to a less robust immune function despite having sufficient vitamin D concentrations. So in the USA and Europe, D3 is considered as a dietary nutrient supplement. But other countries, this is not the case, as in New Zealand, Australia. D3 is preferred, but the highest available dose is a 50,000 international unit, and in India is a 60,000 units capsule. Vitamin D has a wider therapeutic index, therefore these adverse effects are trivial and extremely rare, unless there's accidentally or deliberate overdosing. It also has a very longer shelf half-life, and there's virtually no known drug interaction, and it is extremely inexpensive. So sensible daily exposure to sunlight is probably the best way to obtain vitamin D. Exposure needs anything from 15 to 60 minutes on the direct sunlight towards the midday. Duration depending on the intensity of the skin darkness or the melanin density. Or the supplementation with the vitamin D together with other micronutrients or targeted food fortification programs. So let's have a look at the key functions of vitamin D. Indeed, it is involved with the whole body system to reduce inflammation, oxidative stress, it prevents DNA damage, and indeed it improves the mitochondrial function and cellular function, thereby even the energy generation. Today, in this lecture, we are going to only focusing on enhancing the immune system related to vitamin D. With this slide, I'm going to present you a key concept is essential to all immunological functions against bacterial and viral infections. This had been discovered only recently, about 10-15 years ago, and again has been completely neglected by many practicing physicians. We all know that whether it's coming from the skin or oral, the vitamin D is 25-hydroxylatase in the liver, which is a rate-limiting factor. In the kidneys, it will be converted to 1,25-dihydroxyvitamin D. Let's call it calcitriol. So this hormonal form of calcitriol is about 900 times less concentration than vitamin D3 and 25-hydroxy-D in the circulation. Therefore, its diffusion into immune cell is trivial and not known to influence any immunological function. In contrast, in the intracellular generation of calcitriol in immune cells, for example, through 1,alpha-hydroxylation locally, not in renal tissues, will lead to increased synthesis of calcitriol. This is the most important component in stimulating and boosting the immune system and all immune function. Certainly not this circulating hormonal calcitriol. Therefore, so giving calcitriol, irrespective of the dose, has no beneficial effects in infection and similar illnesses, except that it can cause significant adverse effects. So now let's look at the wind-associated SARS-CoV-2 outbreaks. Let me illustrate with the two slides borrowed from One World in data from is published data. The first one on the top panel is the hospitalization of COVID-19 per million, and this one below is a mortality on the 7-day average. So this is the total number, this is a 7-day average. So as you see, when you look at this data, it doesn't make any sense. The peaks all over the place. Nevertheless, when you overlap with the timing of winter, you can see clearly the peaks occurring during the middle of the winter, extending about 4 to 5 months from January. Now, two things happening during the winter period. Firstly, the colder and drier weather is actually enhancing the viral survival outside the body for longer duration, so higher the infection rates. Secondly, but most importantly, during the winter period, community and individual having the least amount of serum 25-hydroxyvitamin D and D3. Therefore, the immune system is the weakest during the entire year. So combination of those two actually increases the vulnerability for the infection, complication leading to hospitalization, and indeed, as shown in the slide below, the death rates. So another aspect from the same website, what you're looking at is COVID-19 deaths per million population in log scale, against the timing. First cluster, what you're seeing is the affluent countries where there's more than 70% of the population had been immunized, and indeed boosters the similar percentage. The cluster below are the countries located around the equator within about 1,400 kilometers up or down, and they had a significantly less amount of percentage immunization in the community, and the booster doses are indeed at this time was about 5% compared to 70% in the affluent countries. Nevertheless, if you look at the death rate and the total death amount is about 500-fold higher in the affluent countries where they had a very high rate of immunization. And this is the same at any time point you look at it. The difference between the deaths are 500-fold, not percent, higher in the affluent country with higher immunization rates. So let's look at the vitamin D deficiency, what it does to us. It affects every system in the body, to increase the cancer, autoimmunity, increase the metabolic disorders, obesity, diabetes, and the other autoimmune disorders, and non-traumatic acute illnesses like infections and chronic diseases. All of them actually get aggravated in vitamin D deficiency. And again, vitamin D deficiency significantly harm the pregnancy and impair the outcomes of the pregnancy, like infant growth and complication. In this lecture, again, what we are focusing only on increased microbial infections. So, vitamin D deficiency and reduced angiotensin conversion enzyme 2 concentration in the circulation are highest among the senior citizen, older people, and those who especially with comorbidities. And these factors increase the risk particularly for viral infections. Indeed, this risk can be further modified by the comorbidities, aging and debility disorders, and environmental factors. So the combination of all these can increase significantly in certain ethnic groups as well as age groups like older people for viral infection. So whether it's a pandemic or epidemic, this is a fundamental way to look at it. We have to intervene who are the most vulnerable. So here we are looking at the infection risk. We're looking at the COVID PCR positive rate on the y-axis and the 25-hydroxyvitamin D in the x-axis. As you see, with the vitamin D concentration, mean levels are lower, the infection rates are higher. So in other words, PC positivity is higher. When the levels reach 50 and above, it reaches the bottom line of natural infectivity rate. So changing from 30 to 50, serum 25-hydroxyvitamin D itself will reduce the infection rate by 50%. is huge. You can extrapolate that to the complication and deaths as well. So this is the way to prevent these viral epidemics. This slide, what you're looking at is the mortality. Here looking at the probability of survival, inverse of the mortality from COVID infection against vitamin D concentration in serum. So when you look at it, the raising serum 25-hydroxy from 10 to 30 nanograms per milliliter will increase the survival potential by 35%. Huge. In other words, you're reducing the death rate by 35%. Further increase it to 50 and above, it reaches near 100% survivability from SARS-CoV-2. Note that increasing beyond that, whether it's 80, 90, or 100 nanograms per mil, there's only very little benefits of that. So diminution of return. So that's why we think 50 nanograms per milliliter is a crucial cutoff point for getting the immune system boosted. So vitamin D sufficiency prevent COVID complication and deaths. Here's a couple more slides on that. Here what you're looking at the risk of infection. Hospital-acquired infection going back to 10 years ago, it was published. So what you're looking at it again the same. When you increase the rate to 50 nanograms per milliliter in the serum 25-hydroxy vitamin D, you actually eliminate all the excess infection and hospital-acquired infection in this particular case. So raising from 10 to 50 nanograms per mil reduce the serious infection by 1/3. This slide is similar data, but we're looking at the mortality. COVID-19 deaths has a hazard ratio, 1 being the neutral. Again, what you're looking at is the serum level from raising from 10, 30 to 40. Actually, you significantly reduce the death rates. In this case, from raising from 10 to 50 nanogram milliliter, the mean serum 25-hydroxy concentration will reduce the death rate by 6-fold. That's a 600% reduction of death. Costs only $1 or $2 to achieve this. There's a slide from vdmeta.com and c19.com just to illustrate that whether you're looking at the early treatment, late treatment, or prevention, there are about 120 plus studies have published, including the randomized controlled trials, showing positivity. Only 5 trials were shown negative. All 5 of these trials had a significantly negative study design, extremely poorly designed, and therefore no wonder there's any benefit. These studies are basically designed to fail. Whereas if you look at the favorability and unfavorability of vitamin D, it's even in the late 2020, we had enough information to confirm by the health authorities like WHO and CDC and FDA to approve, at least to consider and investigate and approve vitamin D as a supportive therapy for COVID patients, the prevention and treatment. Whereas if you look at the effect of vaccine, its efficacy gradually faded away due to a number of reasons, and I don't have time to go into that, partly because the virus is developing vaccine immune evasion, and vaccine efficacy basically came down to less than 30 or 20%. However, if you look at the vitamin D efficacy, 0 changes, because that has nothing to do with the mutagenesis or anything like that. So any virus, vitamin D has the same mechanism, which is naturally enhancing the immune system, thereby protecting the humans who are on vitamin D sufficiency. I'm going to show you 2 slides to show the importance of early therapies in viral infections. Here's a simplified version. We're looking at the prevention, infection, symptoms, we need to treat at this particular window, not after hospitalization or admitted to ICU with the major organ shutdown. At that time, the benefits of this early treatment is virtually near 0. Here's another beautiful slide from C19early.com. It's a publicly available largest real-time meta-analysis on COVID, and all the drugs and all the clinical studies done with a different agent, almost 39 or 40 agents now. Basically shows that the best efficacy of any treatment, especially the early treatment like ivermectin and vitamin D, is the earliest possible intervention. As the time goes by, the efficacy of treatment and prevention of complication significantly reduced. By day 6, day 7, basically it's reaching 0 benefit. So no point treating with these agents once you have admitted the complications or into the ICU. They need a different kind of treatment. So treatment must begin within the first 3 or 4 days, and certainly not after 6 days of hospitalization and then decide what to do. The last section I'm going to discuss with how to boost the immune system naturally. This slide, I'm not going to go through details, but it shows that the BMI base is how to calculate the vitamin D based on the body weight. So these are described in the 3 separate tables in this particular article in Nutrient published in 2022. Just to give us one example is for a non-obese 70 kilogram adult, daily vitamin D dose can be calculated between 70 to 90 international unit per kilogram body weight. Simple as that. To rapidly boost the immune system, the best option is to use a partially hydroxylated vitamin D, calcifidiol, between 0.5 and 1 milligrams. Actual dose calculation is based here, 0.014 milligrams per kilogram body weight, applicable to every age, every body weight. And this acts within 4 hours, and within 24 hours, immune system is getting boosted. So it will maintain the serum level of vitamin 25-hydroxyvitamin D for about a few days, and therefore it's best to use combining with the calcifidiol with vitamin D on admission or at first encounter with the healthcare person, so that they will have a longer period of higher serum 25-hydroxy level to overcome and SARS-CoV or any other viral infection now or in the future. And this method of intervention is in addition to, of course, to any other best therapies used by clinicians. So this will save lives, prevent the need for hospitalization, ICUs, and tremendously reduce the cost of healthcare. Let me give you one example of the cost of healthcare. So the FDA-approved drugs like Molnupiravir and Paxlovid cost about $500 per patient, and it reported to be reduced hospitalization by 50%, not even deaths. However, if you use vitamin D or ivermectin, it costs about less than $2 per patient. Indeed, it reduces hospitalization by 75%. So no comparison, yet none of those authorities, regulators, and health organizations recommending vitamin D or ivermectin. You can guess what's the reason for that. So vitamin D should be used as additional therapy to infection, any infection, particularly the COVID. It should not be used alone, and it must be used as an adjunct therapy with other agents. And with the first-line medication, together with the micronutrient, as I had discussed a few minutes ago, we'll be able to boosting the immune system to overcome the infection. So in summary, there's a strong inverse association of serum 25-hydroxy concentration and COVID severity and mortality. Better the vitamin D status, lower the complication and deaths from COVID. On average, adult with a 70 kilogram weight, 5,000 of international units a day can maintain the required 24-hydroxy vitamin D. those who are needing rapidly boosting the immune system, if calcifidiol is not available, it's best to use a boosting dose of 100 to 400,000 units as a single dose to boost the immune system. So in addition to public health measures, the way to prevent the future epidemic or pandemic is to maintain the community vitamin D sufficiency and through exposure to sun or supplements, which reduce the symptomatic disease, outbreaks, hospitalization, and indeed death. And most importantly, significantly reduce the hospital healthcare costs. Robust immune system improve the health, minimize severity and death. Suppose we use a similar program in mid-2020, even in 2021, we could have prevented the hospitalization and death by 50% from COVID. Yet, no authorities suggested even allowed to use such a simple generic agent available worldwide without a prescription. So finally, it reduces sepsis-related deaths and healthcare costs. In addition, healthcare authorities should stop interfering with the physician judgment in patient care. It shows a massive interference of the independence of the physician on how they manage best the COVID patient. They know 1,000 times better than the administrators on how to manage patient. Administrators know nothing except what they hear from TV. So physicians and scientists should proactively use preventative approaches rather than rely on the conflicted guidance from health bureaucrats. So prevention of outbreaks, the prevention is much better than the treatment and less costly. Individual and communities, vitamin D sufficiency is the key. Cost-benefit ratio of vitamin D is 1 to 10,000, yet it is neglected. Micronutrient sufficiency is the key to robust immunity and maintain the strong immune system. Vitamin D is cost-effective, reliable, natural way to boost the immune system and to be used as adjunct therapy for controlling epidemics and pandemics in the future. Thank you for listening.